This is a short routine that you can do for some gentle movement after you have a hysterectomy. Let's get started. Four years ago, I had a hysterectomy and major prolapse repair, and I had to teach myself how to move and exercise safely again. I have quite a few workouts out there that you can experience after a hysterectomy, and I have a 10-week post-hysterectomy workout plan as well. I'll have the link below for that. For today, this is a routine that you could safely do within the first few weeks after having surgery for some very gentle movement, just to help with digestion and circulation and to get those joints and muscles working. Of course, always check with your doctor before getting started. So for this routine, we are going to start sitting, and you can sit in bed, you can sit in a chair, on the floor, wherever is most comfortable for you. And the only thing you'll need today is a pillow, or if you have a small Pilates ball, you can use that, but a pillow will work fine. So I'm going to set that aside for now. So wherever you're sitting, I just want you to try to find an upright position. You have recently most likely had surgery, had a hysterectomy, maybe laparoscopically, maybe you had an abdominal incision. Either way, it's important to start to find some awareness through that area, and we're going to do that through a little breath here to start. So again, just finding your most comfortable place. I want you to inhale through your nose and exhale through your mouth. Inhale and exhale. Continue here at your own pace. So not only is breathing important to help relax your body and nervous system, it's actually really important when it comes to pain relief. We've seen that through research, that breathing can actually help with thoracic mobility in your spine, which can help with pain relief. It can help with your movement overall. So making sure you're taking those nice deep breaths will help. It can also help you gain some movement in that area that's going to feel really tight right now. So focusing on your breath has a lot of benefits. Okay, now when you're ready on the next inhale, I want you to bring your right arm up. And again, if you're laying down, it's fine. Just do the same thing. And then bring it back down. Other side. And back down. We're going to do that again, and if you have the mobility, if it feels good, you can lean to the side a little bit with it. But again, that's optional. Even just moving your arms is really helpful. Just again, for general movement, it's one of the best things you can do. Your doctor's probably told you to start walking pretty much right away. Movement is good if it's done in a safe and controlled way. All right, nice job. Arms come down. And now you're gonna lay down on your back and have that pillow or ball close. So protect your abdomen, roll to your side, or lay down on your side first, then roll onto your back. And place that ball or pillow between your knees. Okay, hands can be down at your sides. Take your inhale again, and exhale, squeeze the ball. You're gonna squeeze just for as long as your exhale lasts. Then you inhale, release, and exhale, squeeze. And you're not squeezing as hard as you can. We're just squeezing about 50% effort. This is going to help work your inner thighs a little bit, which attach to your pelvis. It's going to help with your pelvic floor as well. And it's just nice to feel like there's some safe movement that you can do right away that's good for your body. Because I know it can be a really scary time, it can be confusing, it can be frustrating. And so just know everything you're doing right now is helping to empower you to move forward, to get your strength back. Good, one more. Nice. You can leave the ball there but don't squeeze it anymore. Just keep it there. And we're gonna do a pelvic tilt, which means you're gonna curl your tailbone towards you. Just really gentle. I'm just flattening my low back. And then I'm taking it away. And this too will be different depending on how far out from surgery you are. Okay, you might feel really tight and protective, and that's okay. You might feel like you have a little more movement. I just want you to feel like you're kind of rocking within the place that's available to you. Because one thing I really find over time is we can get really tight and protective in our pelvis. So we want to make sure we're reminding it that it can move a little bit. Nice. Come back to center again. I want you to inhale and reach both arms back. And then exhale, bring them back down. Inhale. Last one. Nice job. Take the ball out. And you can roll onto your left side. So I'm just gonna have my head in my hand, my knees are bent, hips are stacked, and lift that top knee up and back down. So I'm keeping my hips stacked. Nothing's rotating through my center right now. But you're working now into your outer hip. Again, really important as we start to protect the pelvic floor. As we start to get moving and walking again, we want to make sure we're staying strong in our hips. One more. Nice. Now, stay here on your side, and I want you to lay flat. And with that left hand, you're going to bring it in front of you. So if you want to have a pillow, that's great here. You can grab a pillow. Right hand is on your left. I'm going to slide the right hand along my elbow to here. And then if you can, open it up to the right. And then bring it back in and slide. Okay, so maybe if you're not feeling all that movement yet, just kind of slide and turn a little bit and go back out. Otherwise, if you're feeling okay, slide, open, and look at the right hand. You're keeping your eyes on the right hand the whole time. And what this is really good for is, again, opening that thoracic spine, that middle spine area. You want to find that balance of movement, circulation, breathing, while also just making it really intentional and purposeful so that you follow the steps one day at a time to build that strength back up. Nice job. All right, from here, you can roll to the other side, or you can push yourself up and lay down on your right side. When you're ready. And this isn't a time either for you to worry too much about your form. If you aren't completely stacked, that's okay. Just the movement alone is beneficial. And 3, 2, 1. Nice job. And then lay down. Right arm comes in front of you, left hand on top. And remember, we're going to slide and open and then bring it back. Just doing the amount that's right for you. And let's do 2 more here. Take your time. I definitely remember those first weeks after surgery and just how slow I had to move to feel safe, to feel protected. So take your time. Nice job. And then you'll roll onto your back again. And arms can come down to your sides. And you're gonna take your right leg and let your knee fall out to the right, and then bring it back up, and then the left, and up. And this one, your goal here is to try not to let anything else move if possible. So when my right knee goes to the right, I'm keeping everything else still. This is kind of a precursor actually to working into our lower abdominal muscles. Nice job. Come back up now. Take your right leg, slide it out away from you, and then slide it back in. Okay, the inhale takes it out, and exhale, pull it back in. And if this feels really hard, put like a towel or a washcloth under your foot. I don't want you to feel like you have to work for it. I want it to slide fairly easily. Other side. This also is a really safe way to kind of start to work into those lower abs a little bit. Again, we're just waking them up. That's all. We're just reminding your body that it is here, that you are here, that you're going to work with it to recover. Nice. And then bring your arms out to a T. Let the right knee fall over to the right. And then look to your left. So it's just kind of a little mini twist. And then bring that knee up. Left knee to the left. And then look to your right. And then back up. And let both legs come out straight. Both arms either at this goalpost position or maybe up overhead. And then bring one hand to your heart, one hand to your belly, and take one more deep breath in and out. And nice job. You can stay here as long as you need, and I will talk to you again soon.